to it. All right. So, really, the goals of this program are to help cancer patients, survivors, and their families replace mealtime and preparation fears with confidence. We want to answer nutrition and culinary questions with evidence-based explanations. And we want to replace displeasing meals with pleasing meal options, enhance nutrition and culinary knowledge and skills. We will begin with a brief nutrition discussion, then get into the recipes and cooking with Chef Jim and Chef Gabby. Just a few housekeeping items. Please silence your microphones. We're recording the program today, so we just want to make sure that the program will be usable moving forwards. Please also direct any questions that you have to the chat, and we will address questions at the end of the hour. Great. So when you're healthy, eating food to get the nutrients and calories you need is usually not a problem. But when you're being treated for cancer, these things can be difficult to do, especially if you have side effects or you're just not feeling well. Good nutrition is especially important if you have cancer because both the illness and its treatments can change the way you eat. Good nutrition during treatment can help you feel better, keep up your energy and strength, can help you maintain your weight and your body's store of nutrients. It can help you better tolerate treatment and treatment-related side effects, can lower your risk of infection, and help you to heal faster and recover faster. One example of an important nutrient the body needs is protein. So we need protein for growth, to repair body tissue, and to keep our immune systems healthy. When your body isn't getting enough protein, it may end up breaking down muscle for the fuel it needs. This makes it longer for you to recover from illness. It can lower your resistance to infection. People with cancer often need more protein than usual. So, after surgery, during chemo or radiation therapy, extra protein is needed to heal tissues and to help fight infection. Good sources of protein include fish and poultry, lean red meat, eggs, low-fat dairy products, nuts, nut butters, dried beans, peas, lentils, and soy foods. And so today we are focusing specifically on nausea and vomiting and how to manage that when you're looking to cook different things and maintain good nutrition. So nausea can be described as having a sick or uncomfortable feeling in the back of your throat and stomach. There are many other words describing the feeling of nausea, like sick to your stomach or queasy or having an upset stomach. Vomiting is also described as like throwing up. Nausea can lead to vomiting, and sometimes nausea and vomiting can happen at the same time, but they could also be totally separate problems too. Chemotherapy and other drugs used to treat cancer travel throughout the body while radiation therapy treats one part of the body where the cancer is located. So for this reason, chemotherapy and some other drugs used for cancer treatment tend to cause more nausea and vomiting than radiation therapy. Your cancer care team knows which treatments generally have a higher risk for chemo-induced nausea and vomiting because there have been studies that shown that certain drugs used to treat cancer are more likely to cause nausea and vomiting than others. The cancer itself, especially if it is affecting the brain or the GI tract, may cause nausea, anxiety or other infections, or even anticipatory nausea and vomiting. So that's the expectation of having, the expectation of that nausea and vomiting coming on because you have had that experience before in a similar setting. Health problems that could be caused by nausea and vomiting, especially kind of now that we're talking about nutrition, include malnutrition, and that's usually because of the inability to eat and meet nutritional goals when you do feel nauseous, and dehydration due to the inability to meet hydration goals or to keep those fluids down. You also lose electrolytes when you are vomiting. So, as far as some general tips go to kind of help manage nausea, we are looking to make sure that you are eating 6 to 8 small meals a day instead of 3 large meals. Um, do not skip meals because an empty stomach may make that nausea a little bit worse. Eating dry foods every couple of hours do tend to settle the stomach. So things like crackers and pretzels. I often have patients that tend to wake up, have some pretzels or crackers on their bedstand table and eat those first thing in the morning just to coat their stomach. Choosing bland foods over fatty, greasy, or really spicy foods. So things like chicken and rice, or a chicken noodle soup, or even buttered noodles, protein waffles, those types of things tend to be fairly well tolerated as well. If smells are bothering you, choosing foods that are cool or more room temperature, avoiding the kitchen during meal prep time, or making sure that you aerate the kitchen can help, or even covering an open cup and drinking with a straw. Trying things like ginger chews, ginger tea, ginger ale can sometimes help to settle the stomach. But one of the most important things in the cornerstone of managing nausea and vomiting would be to make sure that you are taking those anti nausea medications prescribed by your medical team as indicated. It's really important to make sure that you keep up with your nausea if you do have these tools available. So, I just kind of included some lists of foods that tend to be better tolerated when you're struggling with like mild nausea. Again, keeping things typically bland, minimizing those like fatty, fried, or super spicy foods. If you're having periods of intense nausea and vomiting, making sure that you include your provider in that so they're aware, and can help you as needed, but staying well hydrated with a variety of liquids and then kind of keeping almost to the brat diet, like banana, rice, applesauce, toast, can be very easy to digest. And so today's recipes include egg white frittata and the vegan vanilla shake. Each of these recipes follows the general guidelines we recommend for management of nausea and could be suitable options if you are nauseated. So we will let Chef Jim and Chef Gabby take it away.
Thanks, Nicole. Hi, everybody. I'm Chef Jim, and this is Gabby, our sous chef, Chef Gabby. Okay, and so we're going to give you two recipes. One's going to be our frittata. Now, this frittata is going to be with just egg whites. So you heard Nicole talk about protein and how important it is to have protein. Well, you get a lot of it in this frittata, but also you're going to get the nutrients from the vegetables. Okay, and so one of the most important things is that if you have fresh vegetables, you'll have a good tasting outcome in your frittata. It'll work really well. I'm going to show you a quick knife skill because there's also food safety and sanitation. That's an important part of this as well. So I have an onion, and an onion is one of the ingredients in the frittata, okay? And we have our cutting board. Under our cutting board, we have a wet paper towel because we don't want it to slide on us, right? So underneath it, we got something wet because otherwise the cutting board would slide. Now, when we go to take our onion, most people don't wash their onions under water or their head of garlic or their shallots. So we like to tell people and the reason why they don't, because then when this paper gets wet, it'll stick to their hands, their knife, their fingers, and it could become cumbersome to do. So what we try to tell people is if I put a paper towel down on the cutting board, right, and I go to peel this onion just by cutting each end off like so, and I'm doing it on the paper towel, what's happening is now it's not touching the surface of the cutting board. And so then I go and I take the peels off of the onion, okay, like so. And now I could put the onion onto the cutting board and none of the peels touched it. And then to reduce the risk for contamination more, I could just rinse my hand and my knife underwater like so, okay? And now I'm back and I reduced the risk for cross-contamination even greater because that onion was in the bin at the grocery store and we don't know who was touching it and what they were doing and whatnot. So now at least my knife and my onion is more sanitary. And then we would just cut the onion in half. And an easy way to get a nice small dice on an onion is after you peeled it and cut it in half, just like I did, we would just take slices like anybody could do, right? And then I just cut them on my knuckle. So I indent my fingernail under my first knuckle. My blade is always on my knuckle. I cut more with the back part. I rotate the onion and I cut on the downswing. So I'm going to repeat that again. Okay. My hand is like a claw shape. My fingernail is indented under my first knuckle. So when I hold this onion, the blade is actually just touching my knuckle. If you hold food this way, that's how you could cut your finger. Okay. So, and when you hold a knife, instead of holding it like this, it's 3 fingers on the handle, your thumb and index on the blade. And then as I pivot this onion, I cut on the downswing and I get perfectly diced onion every single time. And you reduce the chance to cut your fingers because you're on your knuckle. Okay. Why is this important? Because if you have everything that is nice, small, diced, all the ingredients that go in your frittata, you'll be able to chew better, right? You'll reduce the risk for choking and things like that when things are real tiny and small, right? And if someone has issues with swallowing or things like that, then the finer things are chopped up, the easier that will be to happen, okay? Now, in terms of smells and nausea, if you have an onion that is a sweet onion as opposed to a Spanish onion or a red onion, they have less sulfur in them. So you won't get, that the sulfur part that would make you cry when you go to peel the onion. So if you have a Spanish onion or a red onion, there's more sulfur in there, and that could be bothersome to for smells and to your eyes as well. So the sweet onions, like a Vidalia onion from Georgia or Texas sweets, would have less sulfur in it and more naturally occurring sugars. Okay, so I just wanted to show you that for food safety parts, okay? Now, okay, we have our mise en place, all right? So before you go to make your frittata, all right, you want to have all the parts and pieces ready to go. Okay, so we have our onion that was diced. We have our peppers that were diced. We have spinach that you could buy in a cello pack bag, right? We have turmeric that's anti-inflammatory. We have ginger, fresh ginger that Nicole referenced, okay? And that is finely minced. And then we have some fresh chives. We have, these are shiitake mushrooms. You could use any kind of mushrooms. And we have our olive oil. And then over here, we have our egg whites. So we don't have the yolks, just the whites. And actually, when you go to cook eggs, just the whites have less of they're more mild than the yolk would be if you had a whole egg. Sometimes when if you had a sunny egg, the yolk has actually more smell to it than the white would have. Okay, so that's our mise en place, all right? So I'll put that back over here. Now, for our egg whites, okay, we're gonna try to add some flavor to them. We're gonna put in some fresh basil. And so there's health benefits to all fresh herbs, and basils is definitely one of them, okay? But we want to make it small. So what I did was I took the basil leaves, and I'll just show you again, okay? Here's our whole basil leaves, and I'm just going to put them together, and I'm putting them into a coil, so to speak, all right? And then we're going to cut them crossways, like so, and I'll get fine little strips, okay? They refer to this as a chiffonade, but basically you're just getting little strips of basil. All right. And so then now that I got the strips, I'm just going to cut them crossways and it'll be almost like a dice. Okay. And now this basil is going to go right into the egg white. Okay. And this will be a way to flavor our egg whites. Okay. If the basil is something that would um, be offensive or it would cause you to have nausea, you could easily omit it and you don't have to do it. Chives are part of the allium family. We're going to put our chives into our frittata as well. Okay. And so then now I have a whisk. All right. And so now we're just going to whisk in, as you can see what I'm doing, our basil and our chives into our egg whites. So these egg whites are actually going to have a nice flavor to it from the basil and the chives. We'll set that down there. Okay, let's begin making our frittata. Okay, so I have a 10-inch skillet. Okay, now if you're going to have a pan for eggs, it's best to buy a non, and you don't want to have a lot of fat in it, right? Because sometimes when things are oily or greasy, that could, cause nausea as well, right? Um, so if you have a 10-inch nonstick skillet, don't use it for anything else except your eggs, and that way you'll be able to slide it. It'll take care of it. It'll be easy to flip your frittata. All right. So now, okay, we're going to take our pan and we're going to put it on a medium heat. We're going to add some extra virgin olive oil to the pan. All right. And then now we're going to put in our onions. We're going to put in some red pepper that was small dice as well. Okay. And I'm going to add also our shiitake mushrooms. Okay. Now, shiitake mushrooms, they actually have, when they're raw, they're very mild in flavor. If you go to caramelize them, they almost take on a sensation of baking without the fat at all. Okay, so what's in the pan? Now we could turn up our heat a little bit because the pan was cold, but we don't want it too hot. If you cook things at real high temperatures, that's where you're getting a lot of fumes and aroma. So that could help induce nausea. If you cook it at a lower temperature, slower, you could avoid some of that. Another thing that you have, if your home is and your kitchen is equipped with one, this is a hood above me right here. If you have a fan in your kitchen and you turn it on while you're cooking, you'll exhaust out a lot of those fumes and odors. If you don't have one, then if you have a window close by or something to ventilate, you could do that. Or some of the things they sell now are pretty cool. They sell these little fans that, like, some people that would grill outside, and when you grill outdoors, how the smoke follows you. So if this was the grill, no matter where you walk, that smoke's going to follow you. Well, now they sell little fans that you could clip on. They're on a battery, and they'll push that smoke away. If nausea is an issue from odors during the cooking process, maybe one of those fans could be clipped on a table like this, and it could blow away some of those odors so they're not coming right at you. Maybe something to consider. Okay, so now we got our pan started to get warm. Okay, I'm going to add in our fresh ginger to the pan. And I got a little bit of salt and pepper, both of which are optional. Okay, you don't have to put in the pepper, you don't have to put in the salt. That's strictly subjective and optional. Okay, now you could use a spatula to stir all your ingredients. Okay, or if you want to try to do the pan flip, all you got to do is get a piece of toast or a plastic lid, and flipping things in a pan is the same motion as flipping this lid in this pan. And that's a way that you could practice if you wanted to. All right. So now our onions are cooking with our peppers, our shiitakes. I'm going to add in our fresh turmeric now. Again, so turmeric is also anti-inflammatory, but it's also with black pepper, which has the piperin to help make it soluble. And it's under the application of heat with some fat to help as well. Okay, so now we got that going. All right. And now I turn the heat down a little bit. Okay. So again, you don't have to cook this hot at all, right? You could go slow and you could take your time. Now, One more thing besides the egg whites that's going to go in there is I got some fresh spinach, okay? And we're just going to wilt that in. Now, you could do the same thing to the spinach. Right now, these leaves are whole, okay? But if you wanted to, right, if chewing is an issue or you want to make it easier to chew, you could take the spinach and cut it similar as you would to the basil. So right now, I just did a dice, okay? And this way, it'll be more speckled into your frittata, meaning you won't get like a whole wilted leaf, so to speak. So this might help with chewing if that's something that you want to consider. Okay. So we'll just take our spinach like so. I'll give it a quick dice. Again, if that's not an issue, you could just take it, put it in whole like this, the whole leaves, they'll just wilt right in. The only thing that'll happen though, if you do put in whole leaves, sometimes they'll clump up at one spot or two. Okay. If you go and take your spinach and you just give it a quick rough dice like so, you'll be able to more evenly distribute that spinach into the egg whites of your frittata. Okay, so now we'll put this back in. Okay, and all I did was give it a chop like that. And you could see once you master the ability to use that knife on your knuckle, then all your cutting and chopping gets so much easier to do. Okay, let's go back. Give our stir here. We're looking good. Okay, we'll turn that down. Now we're going to take our spinach. That's going to go in. All right, we're going to give it a quick, it's going to wilt really fast in here, like so. All right, we're looking really good. Now, the last thing that's going to go in will be our egg whites. All right. So I gave them a stir. Okay. Our pan's on low. We're looking good here. Now, again, if you want more, more flavor, if you caramelize those shiitakes a little bit, they get like bacon. They're really good. Okay. All right. So look, we're wilted enough in here. We're looking beautiful. Now we're going to add our egg whites. Okay. But what I'm going to do is I'm not going to just dump them in one spot. I'm going to try to spread it all around the pan. All right. Okay. Now here's the key part right here. We want to tilt the egg whites all around so everything's evenly coated, just like so. Okay. Now you could see some of the egg whites. Yeah, I can see it. So we want to tuck these egg whites in so we don't have any fringed edges. Now because we want to flip this in the pan. So what we're going to do is we're going to fold in and we're going to tilt the pan into the direction of the fold. So I'm going to try to show you over here where you could see. See what we're doing? We're tilting, folding in and tilting into the direction of the fold. By doing that, all the loose eggs are going into that empty spot. So pretty soon I'll have this pan almost vertical, right? Just to get any loose eggs where I want them to go. So see, look, I got it. I'm almost vertical. See how all the loose eggs are going in that one spot? And pretty soon there's not going to be any more loose eggs left. Now, doing it this way goes really quick. A lot of recipes for a frittata tell you once the eggs have set to put it inside your oven for 15 minutes or 20, whatever, right? You don't have to do that. This is going to be all done in the pan on top of the stove. Nothing's going in the oven. It's that easy to do. Okay, so now we just got it. We're going to let it set just for a moment. There's very little loose eggs left. Okay, look, I'm vertical now. Yep, we're done. We're no more loose eggs left. Okay, we're just going to let that set for a moment. And now I got just a little drizzle of oil that was left in my container here. And I'm just going to put that a little bead of oil around the side that was left. And look, now when you could jiggle your whole frittata and it's moving in the pan, it's not sticking, right? that's what you want. You want it just like that. Okay, now we're looking good. You want your heat on low now for sure, right? It's on a low heat. It's cooking just enough to set those eggs. Now that was a 10-inch pan. We have a plate that's going to fit just inside of this pan. And this is how you're going to flip it. Okay. So we're going to put the plate right on top. You could take a towel just to be safe in case this handle is hot. But if you got a cloth towel, remember that's in a gas stove. This is cloth, a cotton, and that's gas. So be mindful of it. Grab it, take it away from the flame. And what you're going to do is one full hand on top, invert it over just like so. And that's your frittata. Now we're going to take it and we're going to put it in one corner and slide it right back in to the pan and put this back on the stove. Okay. And so now you'll get to see, we'll let that cook just for a little moment, just to get the other side cooked. But look at this, is only taking just a few minutes. Now, to give you extra protein, there's a lot of protein there now, but to give even extra protein, we have a whole sprouted grain tortilla. This is an Ezekiel wrap, okay? And this is what it looks like. It's a whole sprouted grain tortilla. There's 7 grams of protein just in this one sprouted whole grain tortilla, which is also optional, okay? And so what we could do, if you want to warm it up, you could warm it up directly on your stove, or you could warm it up into your pan if you wanted to, okay? Or you could put it in a toaster oven. All right, so I got just another bead of oil just to get this lubricated. There we go. So I want to show you that flip one more time. Okay, we got our tortillas. It's warmed up. We're going to put it on our cutting board like so. Okay, and I'll show you that flip one more time at home. Okay, so again, we could take our towel, right? Take our pan. Here's our frittata. We put the plate right on top, full hand away from the flame, and invert it over, and that's our frittata. Okay, so now put the pan back. We'll shut this off. So what we'll do is you could just slide this on to your tortilla like so. All right. And we'll move this so you'll be able to see. Okay. And we got our plate over here. All right. Okay, so now if you want to serve this, which by the way, you could have this for the entire family if you wanted to. All right. Or you could take it and cut it in smaller pieces, right? Where you could have it some the next day for another meal, like so. And I'm just going to put a few here to give you an idea. Okay. And so this is wonderful. It's like eating a pizza, but I want to show you real fast. Okay. So this is what it looks like up close. It's an egg white frittata. But look all the flavor that's in there from all the herbs, the basil, the chives, the spinach. Look how beautiful that looks, right? But let's say if you have issues swallowing, right? And if odors are an issue, you could take that and maybe put it in the window or even your fridge to cool it down if you have to. But now let's say you got issues swallowing, okay? And you wanted to turn this into what sometimes is described as a mechanical soft diet, so to speak. You could easily mince it and chop it. Okay, so you could take some. Now you could chop it with the tortilla or without the tortilla. I'll show you one with both. Okay. And if chewing is an issue, or swallowing is an issue, all you got to do is mince this. Now think of it this way. A lot of people would have a tofu scramble, which is just tofu and a bunch of ingredients scrambled together like scrambled eggs. Well, you could do the exact same thing with your frittata, right? And what I just did now to show you. So if swallowing is an issue, if chewing is an issue, you could still have a good meal, right? If you put it in glass, not use any metal, right? For a metallic taste, if you had like a plastic spoon, if that's an issue, right? And now you can enjoy that frittata where it's minced and chopped, kind of like loaded scrambled eggs, so to speak. Okay. So again, egg white frittata, you could put in your choice of vegetables that you like in there. You get a lot of protein, extra protein from the egg white and the tortilla. Practicing your knife skills is really important. Have a pan that you use for your eggs and for nothing else. Okay, that'll help. And I hope you give it a try. Now, we're going to have one more recipe to show you. This next recipe is a real treat, okay? And we're going to let our sous chef, Gabby, show you how to do this next recipe. Gabby, I'm going to move this so you have some more room over there. Yep. Okay.
All right, and then I'm muted. Probably. All right. Hi, everyone. So, just like Chef Jim said, my name is Chef Gabby. I'm the sous chef here. And before I begin, just something that Chef Jim and I always try to advise our patients who are maybe on like a restricted diet or a modified diet is to, think about all the things that you can have or are being advised to have or instead of the things that you can't have. Something we always say is to love the foods that love you back. And it's so important with whatever diet you're following, just to make sure it's going to love you back in your body. And it's different for everybody. So this shake, it's a great example of that. Especially maybe if you're trying to avoid like a dairy shake or, ice cream, which ice cream has a lot of made addictives. It has sugar, salt, and fat. It's the trifecta. So this is a healthier alternative that we can have instead. So let me I gotta pull my blender here in the middle. There we go. And so we have some just recommendations that we think make a really great tasting shake. So you want to start with your ingredients to be really cold. This is our mise en place. So mise en place it means to put in place. So we have all of our ingredients ready to go before we start cooking, just like Chef Jim had with the frittata. He had everything cut, chopped, ready to go before he was putting things in his pan. So we have just a few main ingredients. We have a very ripe banana. That'll add sweetness to this, but it'll be naturally occurring. And you want to freeze your banana. You take it out of the peel. Typically, frozen banana good up until like a month or so to get like the freshest kind of outcome. So I'm going to put my ripe banana in here, but where it has like, the brown spots on it and starting to be, good for like baking and things like that. We have some unsweetened almond milk. You could use whatever kind of non-dairy milk to make this vegan, like, soy milk that'll have more protein, hemp milk, whatever you like, but this is just unsweetened, plain almond milk. We have some vanilla. So, the better the vanilla, the better the outcome is what we like to say. So that's really, really important as well. I just need a spoon. Pardon me. I'm gonna grab a spoon, sorry. I have some plain almond butter. So unsweetened, no added salt, fresh ground almond butter. Get you a really good outcome as well. But you could switch this up as well. Use cashew butter or something like that, just so you just don't want that added sugar in there or added salt. And then we're going to add a little bit of flaxseed. You don't have to put it in if you don't want to, but it'll add a good healthy fat and protein, just like that almond butter as well. It's going to add a really good healthy fat and protein that'll kind of balance out those sugars in here. But this is really great for summer. I know it's been kind of hot out, or it's good all year as well. We're going to use a Vitamix, which is a high-speed blender, but this will work fine in a regular blender. You don't have to have a Vitamix. We just have that here. And I'm going to turn it up and kind of, this has a variable speed, so I can kind of ramp it up as I go, just until I get a nice vortex and it's nice and blended. And I can even use my tamper, kind of get it moving. There you go. It comes out nice and thick and creamy. Thank you. It's gonna fly away. I'll let it go a little bit. But you can see it kind of starts to make like this vortex in there, so you know it's done. It's got a nice creamy texture, and that is it. Boom, you're done. Tastes just, I mean, it's so refreshing. And I've got 2 glasses. This is a 1 banana recipe, so you can make more with a 2 banana. Just double it if you have like, you know, a family with kids or something like that. But I'm gonna have a glass for me and Chef Jim, and we will do a little toast. But it comes out so good, just like a milkshake. You could do different variables in here, right? With different kinds of nut butters, whatever works for you. If you can't have nuts, like sunflower seed butter or something like that's a good option. Come on in. Want to toast with me, Chef Jim?
Absolutely. So,
Do you have anything to add?
so, this is a great thing to sweeten the throat. You know, it's nice, it's cold. You know, if the bananas are rough, you could keep them in your freezer for up to a month, but after that, if you want to use them, you know, don't keep them in there much longer. You know, good in will help you get good out. So if the almond butter is fresh and it's not really, the bananas are really old for a long time in your freezer. I mean, you got to leave you're gonna have great shape. And you can do variations of this too. So if you wanted to put, you know, maybe a little peanut butter in with your almond butter, you could do that. You could put cashew butter in there if you wanted to as well, or you could soak cashews, put them in the milk and blend that if you want. You know, so again, we tell everybody, think about all the things you can have rather than all the things you are being advised to avoid. You know, by thinking of all the things you can have, all of a sudden it changes your whole attitude. You know, you're not being bummed out by all the things you want to have and you're being prescribed or advised not to have any. So instead, think about all the things you can have. It opens up a whole new world. That's what you want to build your meals from. And we hope you enjoy it. Good job. Okay.
Awesome. Thank you so much.
Okay. So now we'll go with Dr. Umeda. Agree?
Correct. Dr. Umeda, you are up.
Okay, thank you, everyone. Yes, everyone, nice to meet you. My name is Dr. Umeda from I'm one of the staff physicians here, the wellness department, also work with the Taoiseach Cancer Center people. So wanted to share some informations regarding something we call it integrative medicine. Let me pull up the slides. Just give me 1 second. It'll be very quick, like only a few minutes or so. So this is something we call it integrative. Oh, can you hear me okay? Great, good. And can you see the slides? Okay, yes, good, good. Yeah, so this is something we call it integrative medicine or integrative oncology. So if you never heard of, maybe some of you have never heard of the integrative medicine. So let me explain what it is. So our philosophy, we also call it holistic medicine or integrative medicine. So simply speaking, we do everything natural. So natural approach to support you physically and mentally. So we also call it integrative medicine, which is you being like a cancer patient who are receiving the cancer treatment from the surgeons, radiation oncologists, and also medical oncologists, such as chemotherapy, immunotherapy, or some people receiving the hormone therapy or endocrine therapy. But our role is to something additional. Let's say if you are receiving a chemo and experience the side effects, then add something natural. For example, acupuncture. I don't do the acupuncture, but we have acupuncturists in our department, so they may help to relieve the chemotherapy side effects. Or even if you're not on any treatment, but if you feel, let's say, chronic tiredness or migraine or headache or sleep problem, certain like this hands-on treatment might be beneficial. So integrating conventional treatment and something additional supportive approach. So we call it integrative medicine. And our philosophy is mind-body connection. We believe everything is all connected to each other. So we so call it whole person approach. And specifically the diet, what you eat is very important. So our philosophy is you are what you eat. So use as a food, as a medicine. Sometimes I get the question, or very often I get the question from the cancer patient, like, what is the best diet for the cancer? There's nothing specific actually, because your condition can be different time to time. When you're after the diagnosis, or when you're on the chemotherapy, or after the treatment, after the surgery, after the radiation, your condition could be different time to time. So the best diet is really different from, even for the same person, it could be different time to time. But if you need some guidance, yes, we are happy to help. So our department, which is called Wellness Department and Integrated Medicine, we have physicians like myself, and also we have acupuncturists. We also have a Tai Chi instructor who does the very slow exercise things, and also have a chiropractor, and also a massage therapist, a dietitian, and also holistic psychotherapist who does the meditation, guided imagery, like that. And also we have a yoga instructor as well. So variety of providers. So how to support you? Just this is actually the last time I wanted to share with you what is the integrated medicine, especially focusing on the integrated medicine, focusing on the cancer. We also call it integrative oncology. So on the left top corner, you can see the lifestyle management. If you have any question for the nutrition, diet, exercise, sleep hygiene, stress management, we have a specialist. And also we closely work with the Tau-sick cancer centers, have the patient and the family support center. So we share a lot in common in terms of the philosophy. So we are working, collaborating a lot. And this is the teaching kitchen session is the beautiful example for that. And also, if you have a question of the vitamins or supplements, we're happy to help. The one thing is, I sometimes get the question like, if this herbal medicine, is it good for me, like who are receiving the cancer treatment? We have to be very, very careful about that, because most of the herbs may affect the, let's say, chemotherapy or immunotherapy. So I have to say this is quite limited if you are on the cancer treatment. But after that, maybe we can try. So if you need any guidance, we call so we are happy to do some counseling if you have certain vitamins or natural products. But again, when you're on the treatment, basically we cannot do anything. But a certain vitamins such as vitamin D or omega-3 or magnesium supplement, it may help even during your treatment. And under that, you can see the integrated medicine for symptom controls. So you can see like a pain or fatigue, insomnia, anxiety, nausea, vomiting, neuropathy, dry mouth, hot flashes. So lots of cancer centers have done lots of clinical trial, and they found like for certain symptom, bothering symptom, and certain treatment, like this integrative medicine intervention seems to be beneficial. For example, pain issue, acupuncture seems to be good or worth trying, or massage therapy, or even meditation, it may help. If you have a nausea, vomiting, yes, acupuncture may help. So we always do this as an evidence-based approach. Although these are all natural, but something even that is something additional to support you, but we always try to do everything on evidence-based, yes, like based on the clinical data. So that's the quick overview of the integrative medicine or integrative oncology. So I'm just going to stop sharing. Right. Thank you. And I will put, if you have any questions or interested in seeing us, I will put our contact phone number and the email in the chat box. But if you have any question now, I'm happy to answer any questions.
Awesome. Thank you very much.